All right, this is an abdominal assessment. First, I'm going to start by inspecting the abdomen. I would look at the skin, contour. I look for peristalsis, any pulsations. I would assess the skin for any lesions. I would look for any striae or any sort of scarring. I would also look to see if there's any masses or hernias that I could see from here. After that, I would move to auscultation. So I'm going to use my diaphragm and I'm going to listen to all 4 quadrants. Bowel sounds are normal active, meaning they have 5 to 30 a minute. And then I'm going to flip over to my bell and I'm going to listen to the aorta. I'm listening for any bruits. I'm going to go to the renal. The iliac. And then the femoral. Again, no bruits heard. And then after auscultation, I'm going to move to percussion. So I'm going to percuss in all 4 quadrants. Good. All sound tympanic. And then I'm going to do the liver. So I'm going to go right mid-clavicular. I'm going to start at the umbilicus and I'm going to go up until I hear dullness, which is about right here. I would mark that. And then I would start coming down the mid-clavicular line through the intercostal spaces until I hear dullness again, which is about right here. So this would be the size of the liver. I would mark that, measure that. Normal is around 4 to 8 centimeters. And then I would do the spleen. So we're going to do left mid-axillary line about the 10th intercostal. And then I would percuss in there. And then if I couldn't, it should be dull. But if I couldn't, I could have him take a deep breath. And if it was tympanic, I really, if it's enlarged, it's dull, excuse me. And then I would do the gastric bubble at the left lower rib, which should be tympanic, which it sounds like it is. And then I'm going to move to palpation. So I'm going to lightly palpate. Let me know if you feel any tenderness, Alex. And then I'm looking for any masses or bulges. And then I'm also assessing the muscle tone. Okay, any pain with that?
No.
No. And then I'm going to move to deep palpation. Just doing the same thing, masses, bulges, or any pain or tenderness. Oh, you have some tenderness right there. Okay. And then I'm going to move to, I'm going to palpate the liver first. Okay, Alex, you're going to feel some pressure. I'm going to go under the costovertebral angle. I'm going to do a bimanual. So I'm going to come in and go under, and then I want you to take a deep breath. Good. And I can feel that kind of bounce back down and hit my hand. And then we would do the spleen. So I'm going to do the same thing. Sorry, Alex. Okay. Nice deep breath. Good. And I do not feel anything, which is normal. If it was enlarged, I would feel the spleen bumping against my hand. And then I'm going to look at the kidneys. So I'm going to put my one hand under, and I do not feel anything, which is good, because you should not really be able to feel them. I would be able to feel the right more than the left. Good. And then we are going to do the abdominal aorta, so right about the umbilicus above, which do not feel any pulsations or anything. And then I would describe how I would do inguinal. So inguinal, I would have his knees slightly flexed in the supine position, and I would go along the inguinal canal and then down into the groin to palpate, and then the femoral pulses I would just palpate right in here. Okay, you can straighten out your knees. Now we'll go to our specialized tests. We're going to do the Murphy sign first. So I'll be in the right upper quadrant. I'm going to deeply palpate, and I want you to take a nice deep breath, Alex. Good. You can let it out. Any pain with that?
No.
No. If he would have had pain on inspiration, if he would have stopped his breathing, that would have been a positive Murphy sign. Then I'm going to go to check for rebound tenderness. Let me know if you have any pain. Any pain?
No.
Nope, so that's negative. And then I'm going to do the iliopsoas muscle test. So I'm going to have you lift this leg up. I'm going to put my hand against your thigh and I want you to push your leg up. Any pain with that? No, good. So that would be negative. If you had pain in his abdomen, that would be positive. Then we're going to do the obturator test. So I'm going to have you bring your leg up. I'm going to hold you and I'm going to move you laterally and medially. Any pain in your stomach? No. So that is negative. Good. And then we do the McBurney sign. So it's between your umbilicus and your iliac crest. And we're halfway in the middle. And I would just palpate right there. Any pain there? No. Good. So that's a negative sign. And then the Rosefing sign. So I'm going to palpate on the left. Let me know if you have any pain. Any pain anywhere? If he's having pain on the right, that would be a positive sign for appendicitis. Next, we're going to do a couple things. I'm going to have you sit up. And then I'm going to have you face me. Put your legs over the edge. And I'm going to look at your back. Okay, let me know if you have any tenderness here. I'm checking for CVA tenderness. Any tenderness? No. Okay. Next thing I'm going to have you do is I'm going to have you stand up. We're going to do the heel jar hop. So I'm going to have you go up on your toes. And then relax. And then I'm just going to have you drop down. Good. Any pain with that?
No.
No. Okay, so that's negative. Good. Thank you.